What does the Supreme Court decision on the Affordable Care Act mean for our medical care? In-depth analysis from Paul Seegert, managing partner at PCS Advisers, an employee health benefits consulting firm. Paul, your reaction to the decision?
Not surprising. When they had their hearings sometime back, even some of the newer conservative justices conservative or not, Trump-appointed justices had indicated that they felt it was likely severable, meaning if they did say the individual mandate wasn't constitutional, with the removal of the penalty, the supposed tax, then the rest of the law would likely stay. So we were expecting this, I would say.
At least some of this seems to be a technicality, because the justices said that the states lacked this standing to challenge the constitutionality. Does that mean potentially somebody who's been hurt by the law can come forward and launch a similar suit?
Well, it's kind of an interesting story. It is a technicality, and after the mandate was gutted, essentially, Congress passed the law that took the penalty to zero. That removed the damage. So I don't see a real clear path for other folks to bring the exact same kind of suit. And now this is the third time that the ACA has been before the Supreme Court and been upheld. And so I don't expect to see big change. And even if they did shoot down certain parts of it, the reality now politically is that I think the ACA is here to stay, or at least many parts of it that are popular. Things like kids on the parents' plan until 26 and covering pre-existing conditions and stuff like that. Yeah. Those won't be changed. It would be political suicide for anyone on either side to propose changing, especially coverage for pre-existing conditions.
So what's it mean for consumers in general?
Well, if you look back at this 10-year run, we used to spend less than when the ACA kicked off, we spent less than $5,000 per person on health care, and we're over 10 now. It's doubled, more than doubled. And we've got deductibles. Not only have those costs increased, we've shifted a lot of cost. The average deductible today is $5,000. That's up 87% in that same period of time. And premiums are up more than that. And American consumers hold $85 billion in medical debt. Between $2 and $3 billion of that was added in recent months with COVID. So the report card of our performance in terms of making health care affordable is pretty darn bad. What we have done is expanded coverage through subsidies. 31 million people are covered as a result of this law. Most of those, I think it's kind of a little-known fact that most of those aren't getting their care or their access to health insurance through the exchanges. Most of them are getting routed to Medicaid. So 2/3 or so, 20 of the 31 million or so, are expansion as a result of expanding Medicaid. So we'll see. That'll likely continue that trend of expanding access to Medicaid and continuing to up the income limits that allow people to qualify. The thing to me that I wish we would talk more about is how can we actually make health care more affordable. Yeah. And once we have some real discussion around that and bring transparency into the system, we can fight less about this, because we can take this sixth of our economy and really get it under control.
Since you brought it up, are we ever having that serious conversation?
I sure hope so. We are within the industry, and I have about 40 of them a week with employers around the country.
Wow.
We just haven't had political will ever that I've seen on either side. When you get some degree of a mandate where you have the House, the Congress is all the same party as the president and so on, you haven't seen a lot of movement there. And there's so much lobbying power in this industry, and so much waste. You would think we'd have to get to a breaking point. The conversation we had about Aduhelm, that Alzheimer's drug, is a good example of that. How can you take a $90 billion budget for Medicare's drug spend and add $30 billion to it with one drug, and not, especially one that's not shown to be effective, and not get to some sort of an inflection point? I hope we are.
Thanks, Paul. Paul Seegert, managing partner at PCS Advisers.